Commissioner Colleen,
Here.
Chair Baker McCormick.
Here.
You have a quorum present.
Next item.
B, Chairwoman's remarks.
I have none today. Next item.
C, approval of the March 22nd, 2022 meeting minutes.
Move approval, Anderson.
Support.
Been moved and supported. Any objections or anyone? All right, motion passed. Next item, please.
Madam
D,
Chair,
Oh,
I just realized that I was not at that meeting, so I
Whatever.
probably should not have made the motion to approve.
oh, do we want,
I'll move to approve the minutes.
re-
Need a motion to
Third Street.
You didn't
reconsider.
say that.
yes.
Move
I'll
to
move to reconsider.
Finished recording, you may hang up or press 1 for more options.
That one of the subs on this, for a couple of the CMOs is residential treatment services from Bay Pine Center in Escanaba, Michigan, the UP. Do we actually have people going up there for residential?
I believe we do not, and it's been some time since we've had anyone in Bay Pines.
But we're not using them really, or
I've not been using them.
because they're in here, and the other one was another residential services in Onondaga, which is over in Ingham County. So I guess are any of our kids leaving Wayne County for treatment and going residential elsewhere in the state? You said that word currently.
As far as I know, well, since.
That's right. Let me speak to
Sure.
that. So no, we do not have any of our juveniles currently at any of those places. However, we do have a bed shortage across the state. And we also have, in some situations, not having any beds available here in Wayne County with
Yeah.
our CMOs. And
So it's like a safety valve.
That's correct.
Okay,
Making sure that we do, if necessary, that we would be able to use it.
okay, good, because I know how availability is, but it stuck out like a sore thumb, the UP. So, okay, thank you, madam. Thank you for the answer. Thank you, Madam Chair.
Thank you for that question. Any other commissioners? Any questions? Okay, how about let's move to item number 3.
Item 3, requesting commission approval of Amendment 1 to a 2-year contract with 3 one-year options to renew with Bridgeway Services.
Care Management Organization, if you want to.
Again, this is requesting commission approval of the first quarter payment adjustment.
Any questions on this item from commissioners? Okay, we'll move to the next item.
Item 4, requesting commission approval of Amendment 1 to a 2-year contract with 3 one-year options to renew with CCMO Center for Youth and Families.
Any questions from commissioners? All right, next item.
Item 5, requesting commission approval of Amendment 1 to a 2-year contract with 3 one-year options to renew with GrowthWorks.
Of the first quarter payment adjustment under the new contract.
Any questions from commissioners? All right, next item.
Item 6, requesting commission approval of Amendment 1 to a 2-year contract with 3 one-year options to renew with Inside Youth and Family Connections.
As requesting commission approval of the first quarter payment adjustment under the new contract.
Questions on item number 6 from commissioners? Yes, Commissioner Vice Chair
Yeah,
Pline.
I think I've asked about this before, I've been around too long, I guess, we have the 5 CMOs. How recent is the name Insight Youth been one of our CMOs? Did somebody just change their name or did we get a new CMO? Oh, it's the old Star Vista. Good enough. Thank you very much.
And can I ask, did you work with the CMOs prior to this?
This,
Mhm.
with my role in residential facilities and child welfare and juvenile justice, I worked with them.
Okay, so you're familiar with most of them then? Okay, great. Great. All right, so we will take a motion on these items 2 through 6.
Move approval.
Is there support?
There is support.
Right, it's been moved and supported. All those in favor?
Aye.
Hi.
Any opposed? Any abstentions? All right, motion passed. Thank you. We will move to the next item.
Item 7, requesting commission approval of Amendment 2 to a 3-year contract with 2 one-year options to renew with the City of Wayne.
All right, this is our first contact. This is, we have item number 7, 8, 9, 10, 11. Yes, first contact, so we can take those together. Yes, you could go right ahead if you can, starting with item 7.
Requesting commission approval for amendment number 2 for exercising the second and final option to renew our prevention services in Wayne County through the first contact program.
Can you remind us a little bit about this program?
Prevention program with Wayne County. And it is 50% donated funds and 50% out of the child care fund. So there is no general fund use.
And how does the program work?
So it's a referral-based program. The referral is through the court or the schools or community-based institutions.
And are we receiving any referrals from schools? Are we actively engaged and letting the school know that we have this program?
That's actually one of the initiatives on my agenda.
Okay.
My first 30 days is to increase our presence in the schools.
Great, great. And what does the program do for our young people?
Providers that provide the in-home therapy and school therapy, oversight, care, support to families for 12 weeks.
This also includes mental health services, correct? Okay, because the Youth Council is really focused, our Wayne County Commission Youth Council, on mental health. So this is really dear to our hearts. So, and I think prior to COVID, I had asked how are we reaching out to schools, because as a parent, I wasn't aware of programs like this. I was a parent leader in the school, and I would have loved to share this with other parents. I was fortunate not to have to, need these services, but for those grandparents, yeah, so I'm glad you're reaching out more to the schools. All right, any questions? Commissioner Vice Chair Colleen.
Thank you, Madam Chair. So these are kids that are referred by parents or the school that are not in the system. They have not been brought into juvenile court at all, but it's people that are identified as at risk. Is that correct? And how many youth do we have in that program?
That I would.
More or less?
I would say about 200 based off of the last annual report.
Yeah. And I do believe you give us an annual report, like
Correct.
on the success and when is that coming out?
That should be coming up in the next month. It's completed and done.
I'll be very interested in those numbers, how many kids actually wind up before a judge. Well, they wind up before a judge for here, but not for other reasons later on. And I'm delighted, and maybe won't even mention, but that what do they call it, donor funded, the 50-50? I'm delighted that that's still going on. There was a discussion about that a year or two ago that the state might, and I'm just delighted that that's still happening. Thank you, Madam Chair.
Thank you, Commissioner Colleen. Commissioner Dobb.
Thank you, Madam Chair. So I know there's a shortage of social workers or psychologists within the schools, but every school worker, every teacher is under the mandatory reporting. So if they notice something with a child, with a student, they need to report it. Would that trigger something like this for one of these organizations to come in and evaluate the student to see whether they need these services? Okay. Mhm. Okay, that would be great because, hindsight is always 20/20, but we need to kind of be ahead of the game here and start noticing behaviors and then really take action to evaluate a child and see if they're at risk for hurting themselves or hurting others. Can you tell us a little bit about what happens to a child once they're into this program? Like what services do they receive for themselves and for their families?
Once they're identified, they're assigned to a provider or a care management organization, and they conduct the assessment.
Okay, if the counselor that they're assigned to sees something that they determine that this child could possibly do harm to others, how then is that reported to the school or to the other parents at the school? What happens then? Thank you. Thank you, Madam Chair.
Thank you, Commissioner Dobb. Commissioner Marecki.
Thank you. So you mentioned the IEP. Do all these kids have IEP, or you're just saying if there is an IEP?
Find that service is needed and they support.
Okay, got it. Thank you.
Next item, please.
Item 8, requesting commission approval of Amendment 2 to a 3-year contract with 2 one-year options to renew with the Guidance Center.
Exercising that second option to renew the continuing prevention services. Or prevention services.
Or any questions on that? Next item, please.
Item 9, requesting commission approval of Amendment 2 to a 3-year contract with 2 one-year options to renew with the City of Garden City.
Melissa Fernandez requesting commission approval, exercising that second and final option to renew continuation of prevention services.
from commissioners. Next item.
Item 10, requesting commission approval of Amendment 2 to a 3-year contract with 2 one-year options to renew with the City of Westland.
Questions from commissioners? Item.
Item 11, requesting commission approval of Amendment 2 to a 3-year contract with 2 one-year options to renew with Alternatives for Girls.
Any questions? Commissioner Vice Chair Colleen.
Thank you, Madam Chair. I note that this is the second amendment. So they've done their 3-year contract. We've already done a 2-year extension. This is the second 2-year extension. So then we're looking at RFPs at the end or before the end of this.
That is
Okay,
correct.
just wanted to put it on the record. Thank you, Madam Chair.
Thank you. Commissioner Marecki.
Thank you, Madam Chair. I don't remember this one. Is this a, which group is this? I don't remember seeing this before. I mean, we see so many groups, but,
I would have to go back and get that information
Okay.
for you. I'm a little too new as well.
yeah,
Can
yeah.
go
I
back
just don't
historically to
recall
figure out
seeing
when
this.
that was, but I
Yeah.
will let you know that.
Okay, no problem. Thank you.
Alternative for Girls is a great organization.
Yeah.
Yeah, so, but Commissioner Dobb, you had your hand.
Yes, thank you, Madam Chair.
Mhm.
For Alternatives for Girls, is that, are there a certain communities that cover? Sorry, I got my words backwards, but does it only cover certain communities or is it open to anyone in Wayne County? Okay, so, but just certain zip codes within Wayne County?
Oh, but I'd have to go back.
Okay, I was trying to find it in the packet, but okay.
So I do know that the first contact program may be by zip code, but however, the Alternative for Girls program is open for all girls.
Anyone in Wayne
Yeah,
County?
because
Okay.
they're having a apartment built in my district. So that's why I know a little bit more about them. For Girls, great organization. Mhm.
Thank you.
Sure.
Yes,
Well, 2
Commissioner
things. I'm going to
Killian.
make a motion, but I encourage commissioners to visit Alternative for Girls.
Yes.
They're over on the boulevard just off of Michigan Avenue, where they have a residential facility and they do all sorts of things with, they're just wonderful. All sorts of things with one, including a band that goes around at night and talking to young women that are out on the street at 2 a.m. and do you need help? Do you need services? They're just wonderful. They're on the mission. And if it's appropriate, Madam Chair, I'd like to move approval of items 7, 8, 9, 10, and 11.
Is there support?
Or,
Been moved and supported. All those in favor?
aye.
Any opposed? Any abstentions? Motion passed. Thank you. All right, next item.
Item 12, requesting commission approval of the reappointment of Kenya Ruth to the Detroit-Wayne County Mental Health Authority Board.
All right, do we have Kenya Ruth here today? No. Okay, this is a reappointment to the Detroit-Wayne County Mental Health Authority Board. All right, then we'll take 12 and 13 together. Since these
Madam
are,
Chair, I'd like to move the reappointments, and I believe they're both on the executive board now over there.
okay,
I know that Ms. Brown Richards is the treasurer, and I think Ms. Ruth is now an executive board member, but I'll move approval of both the reappointments to the board.
it's been moved and supported. All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, motion passed. We will move to the next item.
Item 14, requesting commission approval of Amendment 1 to a 3-year contract with 2 one-year options to renew with Black Family Development.
Right, and we'll take, these are the YAP programs, youth assistant programs, and I think we have, let's see, 14 through 19. We'll take those together. All right. Your title, please. Mhm.
Division Director, Youth and Juvenile and Youth Services for HHVS.
Thank you.
Requesting Commission approval of Amendment 1 to a change of scope of services to add language, the raise the age language to our diversion program.
Right, are there any questions from commissioners? Yes, Commissioner Khalil.
Thank you very much,
Vice
Madam Chair. Well, the state law changed, so we have the raise the age now, but also mentioned throughout here is the Right Track program. So I'd like to know a couple of things. How long is the raise the age going to last? I assume what we're doing right now are dealing with people that are in the system that need to have their situation adjusted because of the change in law. Does it strike me that it doesn't strike me that that we have to get this group through and then we're back to kind of normal operation. We don't have to, because they're not going to be sentencing juveniles the same way going in the future. So is this, do we see, does this program come to an end in a couple of years?
The program does not come to an end. Raise the age, it will not be going away as far as we know right now. So we're changing the language.
So we'll still be doing those diversions into the future. That's great. So I guess I'll fall back on my old teaching career. Could you compare and contrast Right Track with Raise the Age? What's Right Track?
Sure. So Right Track is the program that delivers the diversion services. Right Track is that program, and Raise the Age is the new law intended to treat the 17-year-olds. And so in order to capture them in that diversion program that we have, we needed to modify that and add that language so that we could service those.
And is Right Track housed here or in the prosecutor's office?
So Right Track, the referrals come from the prosecutor's office.
But we deliver this, so the prosecutor makes us aware, and then we take it from there. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Khalil. Any other questions? I have a question. So the first contact and then the Right Track program, are they similar? But how do we decipher the difference in these programs?
Program that comes strictly from the court. That is a referral from the prosecutor's office. They identify who might benefit from diversion services. So it's a set aside. It's a set aside on any charges until they complete the program. And then that determines whether or not we move forward with charges or set aside that.
Okay. So these are kids that may be in the system if we didn't get them on the right track.
That is correct.
Okay. The first contact is they're not necessarily breaking the law or doing anything that could cause them to go to jail, but we're trying to
That is correct.
prevent them
It's
from.
It's the prevention program. So
Okay.
it's seen as high risk if you look at it as a continuum of care.
Mhm.
Preventative piece, and if that doesn't work and they make it to court, then we have that diversion piece to keep them out.
And then the raise the age is simply 18 and over now, rather 17, you're no longer going to be tried as an adult. How many of those young people do we have in the system currently?
I'd have to look back at that. I know that data is included in the annual report.
Okay, so we'll.
Soon.
Yes.
We'll have that soon. Great. All right. Any other questions from commissioners? All right, so we'll go to the next item then.
Item 15, requesting commission approval of modification 1 to a 3-year contract with 2 one-year options to renew with CCMO Center for Youth and Families.
Next item.
Item 16, requesting commission approval of amendment 1 to a 3-year contract with 2 one-year options to renew with the Guidance Center. Item 17, requesting commission approval of amendment 1 to a 3-year contract with 2 one-year options to renew with Ennis Center for Children.
Right, next item.
Item 18, requesting commission approval of amendment 1 to a 3-year contract with 2 one-year options to renew with Matrix Human Services.
Right, so all of those had to deal, items 14 through 18 dealt with the youth assistant programs and the adjustment being made. Are there any other questions on these items 14 through 18?
We have 19 also.
Oh, we have oh, okay, I'm sorry. Yes, 19, one more.
Item
you.
19, requesting commission approval of amendment 1 to a 3-year contract with 2 one-year options to renew with Southwest Counseling Solutions.
Yes,
I believe the addenda also.
19,
is
yes.
the- no,
14
item
through
20 on the
19.
addenda
Oh, and the
also
agenda item
is the same
is the same thing.
gap and all of
Okay.
that.
All
Right
right,
track, wrong
so
track.
do we take item 20E, I guess, all together? 14 through 20? The addenda item number 20. Okay. Is there a motion?
I'll move approval.
It's been moved and supported. All those in favor?
Aye.
Any opposed? Any abstentions? All right, motion passed. Thank you. Nice meeting you. Oops. All right, next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item.
Public comments.
All right, are there any public comments? Anyone in the audience first? All right, there are no comments here. Any on Zoom? Madam Clerk, any? None? Okay, great. All right, I guess there are no public comments. And we don't have any emails either, right?
No emails.
Okay. All right, next item.
Adjournment.
I'll move adjournment.
Or
It's been moved and supported. All those in favor?
aye.